Multiple myeloma is a type of blood cancer that arises from plasma cells, the white blood cells that produce antibodies to fight infection. Patients with multiple myeloma may experience a variety of symptoms, such as bone pain, particularly in the spine or chest, and fatigue due to anemia. Other symptoms can include kidney problems and frequent infections, as the proliferating cancer cells crowd out the healthy cells in the bone marrow. Treatment often includes a combination of chemotherapy, targeted therapy, stem cell transplant, and supportive care measures to manage symptoms and complications. Risk factors for developing multiple myeloma include age. Most are diagnosed after 60, a family history of the disease, and exposure to certain chemicals or radiation. Here are detailed aspects of the disease, delving into its pathology, patient management strategies, and potential avenues for future research and treatment. Symptoms and progression of multiple myeloma. Multiple myeloma, a type of blood cancer, arises from malignant plasma cells in the bone marrow, disrupting normal cell production. The disease's hallmark includes a triad of debilitating bone pain, anemia, and renal dysfunction. Symptoms often manifest subtly. Patients may experience recurrent infections due to an impaired immune system or fatigue stemming from anemia. As the cancerous cells proliferate, they release osteoclast-activating factors, leading to bone lesions and hypercalcemia, which can cause confusion or constipation. Progressive kidney damage may occur due to light chain proteins secreted by the myeloma cells. The disease can evolve through various stages, often advancing despite treatment, with patients requiring continuous monitoring for signs of progression or complications. Diagnosis of multiple myeloma. The diagnosis of multiple myeloma, a type of blood cancer originating in plasma cells, is intricate, requiring a combination of specific tests and assessments due to its diverse manifestations and stages. Key diagnostic tools include blood tests to detect abnormal antibodies, M protein, urine tests for Bence-Jones proteins, and bone marrow biopsies that identify malignant plasma cell infiltration. Imaging tests like MRI, CT scans, and PET scans reveal the extent of bone damage or lesions characteristic of the disease. Additionally, the patient's symptoms, such as anemia, kidney dysfunction, and bone pain, guide the diagnostic process, and the use of biomarkers like beta-2 microglobulin helps determine the disease's progression and prognosis. Early and accurate diagnosis is crucial for tailoring treatment strategies and improving outcomes for patients with multiple myeloma. Cause and risk factor of multiple myeloma. Multiple myeloma is a cancer of the plasma cells in bone marrow, which are essential for producing antibodies. The precise cause remains unknown, but risk factors have been identified, including age, as it typically affects those over 60, gender, with men more predisposed, race with a higher prevalence in African Americans, and a personal or family history of monoclonal gammopathy of undetermined significance, MGUS. Environmental exposures, such as to certain chemicals or radiation, may also increase risk. Lifestyle factors like obesity can play a role, but research continues to unravel how genetics and other variables contribute to the development of this complex disease. Treatment and management of multiple myeloma. Treatment and management of multiple myeloma have advanced significantly, heralding promising outcomes for patients. Proteasome inhibitors, immunomodulatory drugs, and monoclonal antibodies form the cornerstone of current therapeutic strategies. Stem cell transplantation remains a pivotal option for eligible individuals, often resulting in extended remission periods. The therapeutic landscape is further enriched by emerging treatments such as CAR T-cell therapy and bispecific T-cell engagers, which harness the body's own immune system to target and destroy myeloma cells with precision. Personalized medicine is gaining traction, aiming to tailor treatments based on genetic profiles of patients' tumors, potentially optimizing efficacy and minimizing side effects. Continuous monitoring and supportive care are vital for managing complications like bone damage and renal dysfunction, ensuring an integrated approach for enhancing the quality of life and prolonging survival. The multifaceted treatment paradigm highlights the shift towards more individualized and effective strategies in combating this complex hematological malignancy.